Welcome to Complicating the Narrative, a podcast that takes on the challenging questions in public health by embracing complexity rather than avoiding it. I'm your host, Salma Abdallah, an assistant professor at Washington University School of Public Health. We find ourselves in a deeply challenging moment for global health. From the lingering effects of the pandemic to climate change to escalating geopolitical tensions and significant funding cuts, it's clearer than ever that health is a profound matter of international relations. So, how do we navigate those complex challenges that transcend borders, and how do we build partnership and political will that needed to address global health crises? This is where global health diplomacy comes in, and I couldn't think of a better guest to talk about health diplomacy than someone who has been at the forefront of this evolving field for decades, Dr. Anders Nördstrom. From his early work in the Red Cross in conflict zones to serving as the acting director of the World Health Organization and as the head of the Secretariat for the Independent Panel for Pandemic Preparedness and Response during the COVID-19 pandemic, Anders has a unique perspective on how health intersects with politics, economics, and international relations. When he became the first ambassador for global health for Sweden in 2010, he was in many ways forging a new path, trying to bridge the gap between health science and statecraft, between evidence and politics on a global scale. Over a decade later, as health became more increasingly entangled in geopolitics, the question isn't if we need health diplomacy, it's what kind of health diplomacy works and whether our current efforts and approaches are actually solving problems or even contributing to them. Anders, welcome to the show.
Thank you so very much, Salma. Thank you for inviting me.
So we've known each other for a while now, and I think a way I like to describe you usually is an accidental diplomat. So maybe I just wanted to start first by your history and maybe describing to people who don't know your journey from someone who worked in direct patient care all the way to leadership position in multiple international entities. If you can just walk us through that journey, but also tell us, what did you learn from going from grassroots all the way to the highest levels of leadership in global health governance about the realities and the challenges and the politics of trying to improve health globally?
No, thank you. I can say also I've been called the undiplomatic diplomat. I was very happy when Richard Horton called me that in one of his comments many years ago when I had been in a debate and not being so diplomatic. So I suppose, I've had the privilege to do quite a lot during I've been now working in health in different ways for more than 35 years and have had the privilege of starting in the field, working for the Swedish Red Cross in Cambodia. That's basically the only time I worked as a clinical doctor, but seeing the reality, both from that system, but also from my own system in Sweden, to see what a good healthcare system actually can deliver. But then I had the possibility to get more into health policy, working on development, working for Swedish SIDA. I went to Zimbabwe and Uganda in 1992 when I started working with those two countries. In Uganda at that time, people were dying from HIV/AIDS. There were no treatment. Going from Entebbe to Kampala, the road was just lined up with coffins and funeral homes. So that was before the treatment and before also the big reforms of establishing UNAIDS. So, my journey has been sort of coming from the field, health service, maternal and child health, saw the HIV/AIDS sort of pandemic in Africa, how it was affecting people and the populations there, but moving more into policies and politics and the big international organizations. So having worked then for Swedish SIDA, both in Sweden but also in Zambia, I had the opportunity then in 2001 and early 2002 to be part of establishing the Global Fund to fight AIDS, TB, and malaria as the Interim Executive Director, which was an interesting journey, and especially when you speak about health diplomacy, because this is just another example that it just happened. They just asked me. And I told my story many times. I was so naive. I didn't know what I was doing, to have a first board meeting, to write the constitutions, to get the organization up and running. The message I say, don't be afraid, dare to take risks. And when you look back, you might be a bit frightened that you dare to do it. But yes, I did that. And I had the privilege of doing that. And I learned a lot. So by also embracing in some way opportunities and being prepared to put in hard work and also to taking a bit of risk, you can achieve a lot. And then a year later, And then again, the very unexpected Director General then for WHO, J.W. Lee, called. He was not the candidate that people expected to be elected as the next Director General after Dr. Brundtland, but he was, and he asked me to become his Assistant Director General for General Management. And I said, I don't know nothing about administration. And he said, that's exactly what I want. I want somebody who understands administration, understands what administration will deliver coming from the programmatic side. But then I went in sort of into the high politics, because he very sadly passed away almost 3 years later, and I took over as the acting Director General. So that was really in the very hot seat of international politics. And again, a privilege. It was a very emotional situation, but of course, it was a lifetime sort of experience having had that opportunity, and I learned a lot. And then I continued back to Sweden as the Director General, then for Swedish SIDA, where I faced some challenges because I didn't fully understand the Swedish politics. So gradually I've been sort of more and more interested in and learning from politics. I've never been a politician, but seeing that there is rationale and there is a reality of politics that we as health professionals and technical people need to invest a bit in and to understand. So what I came then to work with or on was then I moved into the Ministry of Foreign Affairs, and I became, as I said, the Swedish ambassador for global health, the first one in the world in the foreign ministry. And I had that position for 13 years. And I worked at that time with my minister, Gunilla Carlsson, who I'm working very closely with today. And we came to become a very, I would say, productive partnership. She was the politician and I was the expert. And we saw the mutual benefits. Me seeing what she needed as a politician, and she saw what I needed, and I could give her what she needed to become a successful politician. And again, she could give me a bit what I wanted to be able to advance the work I was doing. So my journey has been a journey around coming from basic healthcare, maternal healthcare, health systems. If you heard about the 6 building blocks, that was my idea once when I was in WHO. Always working at a very practical level, and then getting into politics and diplomacy, but not from a theoretical point of view, but again, from a practitioner's practical point of view, to see how we can equip a new generation of leaders with, in some way, the experiences, the tricks and tools for how do you navigate in the politics.
So this actually, I have a lot of questions from what you just said here, but just for our listeners who don't know what SIDA is. So SIDA is the Swedish International Development Agency.
Correct.
And it's been doing amazing work. Even in Sudan, when I was in Sudan, living there, the Swedish SIDA really had a lot of impact, especially on the lives of a lot of young children in Sudan. So I remember SIDA fondly as someone who was on the recipient side of things. But I think it was interesting to me what you said about you've been thrusted into positions that you would say I don't know much about, but it's clear to me that was it just your passion because you're interested in advancing and improving the health of the global population that you would get into those positions and you would learn what needs to be done, or did you take more time when you accepted a position to really learn more about the position as people with expertise? How did you navigate this new positions, especially when you were asked to be the first ambassador?
I mean, the answer is very easy. I've never taken any time to learn anything, so I'm not sure what I know. No, I learned by doing, and I learned a lot. I always reflected. I always have interacted with people to get their advice. I've had an idea, a vision, and then checking in, testing ideas with people, and by doing that, shaping sort of the way forward. But I've never gone to school, basically. I went to medical school. I never done a master. I never done a PhD. I never went for any management trainings. So it's been learning by doing. But my passion has been really to make a difference and seeing where I can be useful. And my mantra has always been that making the impossible possible. So I've always seen the opportunities, the solutions. I hate problems. I hate people that are only pointing to problems and that things are not possible. There's always an option. There's always a way forward. And that is where I've seen those opportunities, I've been prepared to put in my time and effort. But it's been more coincidences than it's been a very deliberate sort of strategy.
So then, if we're thinking now maybe more about what you're trying to do with his health diplomacy, and just a disclaimer, I was part of the first cohort of fellows for this new venture, which is a collaboration between you, the Karolinska Institute, and the Stockholm School of Economics. At least to my mind, as someone who participated, and I believe you just finished the in-person training for the second
Yeah.
cohort, it seems like you are taking what you learned on the job, what you learned through just really pushing forward because you have passion, and trying to put it in a way that is more accessible to people who are just starting in the field right now, so they don't have to go through the same barriers and challenges that you have. I'm not sure if I got that right, but maybe explain more about this venture for people.
No, I think you are, but I mean, we're still trying to bring in a little bit more of, I wouldn't say science, but professionalism, from both from a pedagogic, but
Yeah.
also from a scientific point of view. And that is why we're doing this program as a collaboration in between the Stockholm School of Economics, to bring in a little bit more political economy perspectives into this, and also bring in the Department of Global Public Health at the Karolinska. So as a side effect of what we have started this program, we have also 4 research groups up and running, doing research around this agenda right now. So, I mean, I was possibly playing down a bit that what I'm doing, I don't know what I'm doing and have no training. But there is, of course, in some way now in this program, we bring in expertise in terms of how do you basically support and develop a group of people, and how can you link that to develop competency frameworks and research around this. But what we're doing is that I'm running this with my former minister, the person I said I came to know more closely when I became the ambassador. So we have one former minister and one former ambassador who's running this program. And the program is based on the practical skills, tools, for how do you navigate in the politics. So we don't train, we don't teach anything, we have no lectures. So it's not about global health, it's not about WHO, it's about themes. And the themes are about understanding decision making. Who's really got power? Is it the minister who decides? Or is it so that you need to reach out to the political advisor? Then you need to know who the political advisor is. Is the political advisor in France in the Minister of Foreign Affairs? Or is the political advisor in the LSE Palace? You need to know that. And you need to do your homework to understand who's really having the influence, who's holding the pen, and then who's writing the speech for the minister. So that's the first part, to understand in some way the powers, making a power analysis and understanding that there are different stakeholders, not just the politicians, but people in the administration, but also civil society activists, the private sector, what influence do they have? So and we're doing this by using practical examples, storytelling, practical examples of how people did this. A second dimension is in terms of how do you create your networks? Because that's also essential. People are speaking about networks and that trust is essential. But how do you do it? How come that you can trust someone? How come that people trust me and I trust other people? What are the tricks and tools to invest in your network and your colleagues? That takes work, that takes effort, and there are tricks and there are different ways of doing that. And again, that's something that we try to share in this program. Or communication. Communication matters. How do you communicate with people? What language do you use? What body style do you use? What body language do you use? When are you speaking and when are you trying not to speak? So, I mean, there's a lot here in terms of more the practical tools, tricks for how to navigate in politics. And of course, if I look back now 30 years when I started, it was difficult at that time as well. So it was not easy. But it's difficult in a different way, I would say, today as it was at that time.
And I think I fully agree with this. What was really interesting for me, at least as a recipient of this program, when I was at the fellowship last year, it wasn't just the first component, which is exactly what you said. I appreciate it as someone who's on the science side of things right now. We would start the conversation with some political basis for the conversation, but what was interesting to me was those two components that I think maybe when we get to mid-level career, you don't necessarily think about them. The first one is networking, which I very much appreciated. I'm glad you thought about that first, and learning from people who are doing similar work in other parts of the world. I'm still in communication and collaboration with a lot of those people. But I think the second part that I found very helpful was the people who did learn by doing, who were telling us their experiences. And I think what I learned a lot from them was just continuing to believe that you want to do something that is helpful for the global population, keep pushing even when things are getting hard. I think that's the passion or the commitment that I mostly took from all the work that or all the conversations we had. So I think to me that's really the benefit, the main benefit of that fellowship program.
This year we brought in somebody from the non-health sector. We brought in Johan Rockström, who's kind of the rock star on climate, sort of the tipping points and the planetary boundaries is his research. He's now the director in Potsdam in Germany. But he came then to tell his story in terms of how he has navigated in the politics to get political attention then for the climate agenda and his tricks. How has he managed? Yeah. How has he managed to work with Greta Thunberg, who is a world famous now leader on climate? What has been the way that he's been working behind the scenes supporting her? So he shared his tricks, and they were not so very different from how we do it in the health sector. So that was just another person sharing his experience then during this year.
So maybe then stepping back a bit, and I just realized we didn't do it, maybe because you and I talked about this a bit, but how did you define health diplomacy for the fellows on their first day when they got accepted? What is health diplomacy?
Health diplomacy is about, it's a little bit what I've said. It's the tools and tricks for how do you navigate in a political landscape with the ambition to achieve a goal, which is about improving health, coming to a decision that will enable improvements in health. But navigating in that landscape with different stakeholders. So health diplomacy is not just something for foreign policies and people in the foreign ministry. This is about different actors in society, civil society, activists, private sector with positive or negative interest in improving health. Of course, people in the public sector and also in academia. So health diplomacy is about how is this community interacting and navigating, and what are then again, how is that machinery working? So health diplomacy is about navigating effectively in the global landscape, but also, the same tools you use, and I think that we are using them more and more today at the regional level, not just at the global level. So, so that's basically, so we speak, I speak today less about global health diplomacy. Today I speak more about health diplomacy because the tools and also because of, how the world is moving, more and more is happening also politically at the regional level, in the African continent with the African Union, in the Middle East with the Gulf CDC, in the Asia with the ASEAN. So it's about also recognizing where are arenas where important political decisions are happening. And in some way, again, looking back, we looked only at the UN. Today, a lot of decisions are happening outside the UN, and again, some of them more importantly at the regional level rather than the global level.
Someone would say maybe now there is a lot of retreat from multilateralism, not just globally, even at the regional level. Do you think that changes how you think about health diplomacy now, or what you train people to do now?
That's an interesting question. And I think my own belief is that, yes, we need to continue to ensure and invest in multilateral cooperation because we need that. But we need also to bring in the reality of today that the old, quote unquote, traditional multilateral system with the traditional kind of negotiations for political declarations or resolutions, etc., question mark how useful that is. But we still need an international system where we can come together as international partners, meaning governments, to still agree on directions and on certain decisions. But I think we need to recognize that there are other fora that are possibly even more important now than in the past. Most of those are informal settings where people are coming together. So if you take, the World Health Assembly, for instance, people believe that the World Health Assembly in May every year, people are coming together, negotiating resolutions. That is the most important. And the most important work is happening in the Palais where the assembly takes place. I would say the most important work is happening in the lobby of the Intercontinental Hotel. That's where business are done. That's where decisions are taken. And that is, in the past, I didn't like that. When I was in WHO, I really tried to say that, no, focus on the main work. But today, a lot of progress is made by people meeting. Civil society, different other international organizations, private sector, coming together and saying, okay, how can we invest in something new? It could be new thinking around health and climate, or it could be a new innovation, a new product. A lot of that is happening outside the formal board meetings or international negotiations. So I think one needs to take that reality into account. Second is that some of the more big picture geopolitical situation of today has also have huge impact on this. Russia now not being part of the G8 any longer, of course, but the US now partly being part of the G7 any longer, G7 having much less of an impact. When we started the Global Fund, the G8 decision in Okinawa was crucial to that. They don't have that kind of power any longer. G20, possibly more important because you have a broader range of countries then engaging that. What did South Africa achieve this year in terms of advancing the health agenda, being the G20 president? Question mark. What will the US do next year? Big question mark. Yeah. Will the BRICS countries now be more of the fora? But then within the BRICS group now we have Iran. I mean, we have a number of countries that some of us have some issues collaborating with. So, I mean, you have a different political landscape, not only positive, but also negative and problematic. Then you have a lot of informal processes happening. So I think for health diplomacy, you need really to be able to navigate in this and not thinking that health diplomacy is only about negotiating resolutions in WHO or political declaration in New York. But having said that, I still believe that certain multilateral intergovernmental work and decisions are important, but I think we need to redefine what are those functions, issues. I mean, some decisions we are taking both in New York and in Geneva has been very important for people's health. So I think we still need to carefully think in terms of where do we actually need to come together as governments also to make commitments. But I think that require more thinking in terms of what are those global functions, and I think we need to narrow those down more than what we have right now. And that has implications for diplomacy, what kind of work we do.
Yeah, and I was thinking, so just quickly, if you're a local person in a health ministry somewhere, just quickly, G8 is the largest 8 economies in the world. G20 is the largest 20 economies in the world. They meet together, and BRICS is a collaboration between Brazil, Russia, Iran, China, and South Africa. So just some of the language that we use.
Now they expanded a bit, yeah.
Exactly. But I think that is really important because now thinking about what you just said and thinking about how the world is actually getting way more complex, it makes me wonder if someone who's sitting in a Ministry of Health, what is their incentive to push forward for health diplomacy? Why would they think this is actually now might be something that might be helpful, given that it seems like the world is just getting more and more complex? I've heard a lot of stories from you. I don't know which ones you can actually tell on a podcast, but I was thinking things actually were, I liked what you said earlier. They're hard right now. They were still very hard early on. They were just hard in different ways. I don't know if you have a good example for where health diplomacy from someone like you who was not a politician actually led to tangible differences. I know you talk about the Global Fund, anything that you can actually share on a podcast. I'm just thinking, I'm sitting now maybe in a local office in Sudan and feeling very depressed that maybe there is nothing I can do. What would be a story that you would tell us that you would say that things can actually change?
I mean, before telling a story, just to say that no countries can manage on their own. Not even the US, even if the president believed that, but I don't believe that. And especially for smaller countries like Sudan or Sweden. Sudan is a bigger country than Sweden. We all need to work together. So, I mean, even if things are now moving in the direction that countries are taking more responsibility themselves, they have more resources, which is brilliant, strong political interest, more national sovereignty, which is good, but you still need to work together. Because countries are not big enough. If you're going to do research, you need to work with researchers in other countries. If we're going to manage health security threats, definitely you need to work across the borders. So I think the incentive for somebody in the ministry in Sudan is both that you are dependent also on other countries and colleagues in other parts of the world, but also you can develop your own skills and competencies and thinking by also working with colleagues. That's what we do in Sweden. Sweden is regarded as quite a quote unquote an advanced country, but we are really benefiting from working with people from other countries to be able to develop our thinking and skills. And again, we are also dependent on what is happening in other countries. So I think one shouldn't underestimate how both exciting and useful it is for people. If you sit in a ministry, in a government, you might think that what I'm speaking about, the big G8 or whatever meetings and being acting director general for WHO, yes, but everybody needs somebody else to work with, and you can benefit from that. I mean, a story. I suppose, I was mentioning the Global Fund, but I can take another story in terms of what you can do that could hopefully lead to even bigger impact. Again, as I said, I have had the privilege of doing quite a lot, and when people are looking at my CV, some are getting a bit impressed. I've never been impressed because I've never seen myself as a very sort of important and influential leader, but I've always been, as I said earlier on, passionate of trying to contribute and looking for opportunities. So this was in 2013. We were coming to the end of the Millennium Development Goals, the MDGs. And if you remember, we had 8 MDGs for in total, and 3 of them for health, reducing maternal mortality, child mortality, and dealing with the 3 diseases. So 3 out of 8. And there was a lot of discussion around what should be the future global goals. And the UN launched a process then, different thematic consultations processes to say what should be the goal for agriculture, for food, for water, etc. And then they were asking for volunteers to dig into what should be the future for global health. And I had been working with another African country, with Botswana. And I thought, okay, this might be something. I didn't know what it was again, but I thought we could potentially do something exciting. And I called a friend in Botswana, the deputy PS there, and she said, yes, let's do something. And then we began a 6-month consultation journey, opening up for consultations with stakeholders across the world. We ran a number of seminars to try to see what can we learn from the MDGs, what we have achieved in terms of reducing child mortality, maternal mortality, but also reducing the prevalence of those 3 diseases. But then thinking about the future. And then this ended up with a high-level meeting in Botswana in March 2013. It started 2012, so the meeting was in Botswana 2013. And basically then we came up then with what is today SDG 3. So there we had already an idea that the future goal should be reducing or maximizing healthy life expectancy, ensuring that people will not just live long lives, but long, healthy lives, adding health to life, not just years to life. So we had that idea. There was a lot of support for this, but also quite a few people wanted to have universal health coverage as the main goal. And we believe that UHC was an important means to an end, but it couldn't be the goal. The goal must be improving health. And so again, what you can do then in terms of health diplomacy is both to manage a process so that people are aware about what you're doing. You gain some confidence because you have reached out to a lot of people so they know about this. You engage some of the top leaders, which we did in this meeting in Botswana, but then you hold the pen, the most important. So the day after that meeting, we were 4 people writing the story after that meeting. And then we basically defined SDG 3, and the rest is history. The only sort of here is that very few people still have internalized and understood what really SDG 3 is about, that this is about maximizing healthy life expectancy. We're gradually getting there, but people are still seeing health as mainly improving and providing more health service, not really maximizing healthy lives. But that was, again, I was in the foreign ministry. I was basically no one. I just saw this on an email that they were looking for someone. And I took this initiative, called a friend in Botswana. I said, can we do something? I had some small money from the Swedish ministry that we invested in this. And I would say quite big impact because we shaped then the present goal for health.
Yeah. It's interesting to me that you talked about SDGs. I've been thinking a lot about this recently. It's not really a question I had in mind, but I'll throw it at you right now because I think you might give us helpful insights on this. I really appreciate that the goal was actually thinking generally about health and well-being and maximizing health benefits for people, which I think 20 years ago would have been a harder conversation than today. People more and more engaging now that we're thinking about how do people live healthy and longer instead of just thinking about health coverage, which is it is an important, as you said, as means. I've been thinking recently about the frustration and some of the frustration I hear from younger people who work in health and health diplomacy. And I wonder sometimes if we think about metrics not in a more helpful way. So you've been part of developing this metric, but I wonder if you set the goal, which is a really ambitious goal, to improve the health of the global population. But then unfortunately, we don't reach that goal. And then we have complexity in the world. And I'm not sure how do we, if we're thinking about how do we write the next goals for the global population, how do we set a goal that is aspirational, but then also recognizing that not getting to it doesn't mean that everything failed, that we just keep going. I'm having issues now thinking about metrics in a way that is, yes, it's helpful, but also not in a way that just makes everyone frustrated that things never change, because things actually change. Things do get better.
Yeah. No, I think, and I like the title of this conversation, which is about complicating the narrative, because this is really what this is about, that the world is quite complicated and we need to accept that, but then we need to simplify the way that we are communicating. I think that's the answer to the complicated narrative. Before going in a little bit more in terms of on the health side, coming back to the climate side, I mean, we have a very clear goal, a very complicated narrative as well. If we're going to save the planet when it comes to climate change, it's an enormous complicated task. But the whole world is aware about the 2 degrees. The world is getting too hot, too warm. Global warming is a reality. We're measuring that. So it's a very simple one. It's a very simplistic one. It's just a proxy indicator, of course, what is happening. So why can we have then a global goal for the whole climate community measuring how warm, how hot is the world getting? So why can't we have that for health? And coming back then to the goal of healthy life expectancy, when we began to speak about this, that the goal needs to be maximizing the number of healthy years you get, people didn't believe that that was going to be possible to measure to start with. Now, WHO, second years in the World Health Statistics, this is the first chapter actually measuring healthy life expectancy and seeing how the gap in between life expectancy and healthy life expectancy is actually increasing. So we're living longer, but not healthier. So you can have that as a global goal and you can measure that. And I've also referred to the minister from Singapore, who I was listening to now a year ago in Melbourne. And he said, the goal for me in Singapore is to reduce the gap in between number of life lived and healthy life lived. And the gap in Singapore is 10 years.
Wow.
And he knew that. He knew that the gap is 10 years. So he said, like I'm doing, people need to die. We should die. No, that's not an issue. But we should be staying healthy as long as we can. This is good for productivity. This is good for you as a human being. It's good for the society's healthcare cost. So if we can focus on making sure that people live functionally healthy, and I see that people are beginning to see that they can use this as a way of also measuring. You asked about the metrics. And Minister in Singapore, that is what he's doing. He wants to get that gap down from 10 years to less years of lost healthy lives.
How does he convince people that we can keep making progress even if we don't get to the goal that we want this year? Have you encountered that before? Have you encountered younger people? And we can get to climate change now, because I do think it's an important topic both you and I work on, where how do we stop people from feeling frustrated that the progress we're making is not getting exactly to the point we know? We know the climate change goal, but it's taking us a longer time to get there. How do we stop frustration from becoming just burnout and then giving up?
I quite like frustration. it's good with people that are engaged.
Yeah.
I mean, if people are not engaged and
Yeah.
a bit frustrated as well, I don't think we see any change. I mean, that's really where activism is coming from. And if you don't have the answers, we need to get the researchers to help us to get better answers. And that in some ways coming out of frustration. Then, of course, we shouldn't have people giving up or being, as I said, burnt out. So that is important, that you still find a way for people to channel their frustration into something more productive. But I would say, I mean, on the climate side, I mean, there's a lot happening. And I think we, from the health side, we can learn from that. I mean, where I'm deeply worried about what is happening in the world. As I said, today it's hot in Stockholm here, much hotter than it should be. So climate change is real, absolutely. But on the same time, I see things are happening. People are beginning to take action. I was in China now quite recently. Highest numbers now of electric cars. Air pollution has gone down in Beijing with 50% during the last 10 years. So things are happening, not at the speed we need, not quick enough, but still there is movement. And I think really health can join hands with this movement in terms of what is happening on the climate side.
Yeah, and what you've been really working on this project and this concept, and you and I collaborated on some of this work, which is like co-benefits for health and climate change. Can you just tell us a bit maybe about the concept of co-benefits for those who don't know about it?
No, it's in some way it's very simple. That I mean, if we can get both climate benefits and climate results impact and health impact and results on the same time, the better. And if we know what leads to good health, and we know what leads to a better planet, and a less negative climate impact on our planet, then we can achieve what we call then the co-benefits. Practically, to make it a bit more concrete. I love the examples of looking at what is happening in cities. Urban planning, urban design. Cities today are getting greener. Many cities in Europe, cars are moving out of the cities, more bikes, more green areas. How do you design the houses? Practically, more green areas, more bicycles. A lot of this we're doing now for the climate, but the health impact is, of course, there as well. The problem today is that we are not visualizing it, which we should be doing. But really, the co-benefits is about showing that having this green area in an urban setting, trees are good for the climate when it comes to green gas emissions or reduction of carbon dioxide. But it's also good for shade if it's getting hot. But also parks are also excellent for kids to go out and play, playgrounds. For kids not sitting and playing with their telephones, but going out and playing football or something else. So, I mean, you can have a lot of practical co-benefits by thinking in terms of how you basically develop your societies. And urban planning is one aspect of that. Energy systems, food systems are other aspects where you can get those mutual benefits. And if you know what is really impacting our climate, but also impacting our health, you can see where we get those what we call co-benefits or mutual gains.
Yeah. And you're in the room, for a lot of those conversations. If you're sitting with a finance minister or someone from the Singaporean Ministry of Health, would you change the tone or the evidence that you use? Do you think it's more powerful to talk about the health benefits or the climate benefits, or do you think actually having a mutual benefits conversation is useful in both of those areas? If you're, depending on where you are.
I would also bring in the economic benefits in that conversation if I would be with the Minister of Finance, because both, they are huge benefits. And saying that by doing one investment, you can achieve two outcomes. I think that's a good argument with the Minister of Finance. But also, I mean, by investing, again, coming back to a more healthy population, if we have a population that is living long, but more healthy, more productively healthy, of course, that's brilliant for the economy. You have people that can work. You have people that cost less. And especially with demographic changes, mainly then in the Middle East, in Asia today, elderly populations. I mean, the economic argument here to ensure that you can have people remaining healthy, and if you do your homework to see what is really affecting people's health, which are mainly the NCDs, the strokes, the coronary heart diseases, the cancers, and knowing that the risk factors are about food, physical activity, air pollution. So it's just doing the climate work even better. And then we get the side effects then on people's health as well. So showing, I was in the argument with the Minister of Finance, I think they are very receptive today to the climate argument. Infrastructure investments need to be green and climate smart. I think most Minister of Finance, not all, but very many today, if I can also show them that those investments are not just good for the climate, for people's health, you can actually make some savings here economically.
So then this is really...
I hope he will like me, or she will like me then.
Yeah. No, and I think this brings me to the first critique that I hear people talk about when we talk about all of those issues. And I've heard it from people when I present to them. A technical officer sitting somewhere who mostly focuses on infectious disease might hear all of this and say that despite our all of these good intentions, Anders needs to learn more about economics. It seems like it. You also need to learn more about food systems. You need to learn more about energy. Isn't this some kind of health imperialism? And the argument really goes is that if we think about everything from a health lens, if we call poverty a health issue, if we call climate change a health issue, if we call conflict a health issue, we're essentially making health experts the voice that needs to be in every single room. First of all, do you agree or disagree with that? But also, do you think we are risking a professional overreach? I think you know where I stand on this, but what would you say to someone who thinks that way?
I mean, the first one, why do you use the word imperialism? Imperialism for me goes back quite a few years. It has much more to do with the colonialism. Yeah. But I understand what you mean, and I don't think you mean that. But you mean something different, but also kind of imperialism, by trying to take the space everywhere and trying in some way also to control and to drive the agenda. I think that's, again, coming back to the title of this, the complicating narrative that being in the room, yes, being there as a resource, but not being there to tell people to do help. And that's the difficulty as part of this. And again, that is what I'm facing. When I speak to transport people, energy people, or food people, they think I would like them to invest more in the health sector and health service. No, I would like them to do more on food and energy. So it's a difficult narrative or communication issue here, but it's not about taking over, but it's more to sort of offer some knowledge that could help them in some way. And in some way, I don't like the word help, because then you're getting into more of imperialistic sort of mood of thinking. But I mean, in some way, you can equip the agenda with some more knowledge. And if you're going to build a road, you can build a road in a certain way. And if I can say, just advising very gently, saying you can build this road so that people can not just go by the cars, but also with the bikes. Yeah. You might think about this, but this is not about me being the imperial sort of master telling them to, now you need to do health, but advising them in terms of how they can do better infrastructure investments.
Yeah, I've seen this term used in articles, and I had the same reaction as you, because I teach a lot of this to my students, and then they ask me, so what are we supposed to do then? And my answer, maybe people wouldn't like it, is honestly, I think if you really want to improve health, you would go work in the transportation department and bring a health lens to it. Say, if you maybe do this thing, then you actually improve health outcomes. Like, that's what I actually genuinely believe, is we're not trying to tell people what you need to do. We're just saying, maybe if you consider health, you can pick a slightly more expensive option right now that in the future would actually benefit people much more in terms of health outcomes, but also in terms of the system. So I actually fully agree with you on this.
Yeah. But on the same time, as you said, I mean, it is a complicated reality, and of course there are people that would like the infrastructure people to look more for a gender perspective. By doing this, you can achieve better gender equality, blah 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 blah. I mean, there are many competing interests here, so I think one needs to be realistic about that as well. So I mean, my approach is that yes, I'm available, I can offer you something, but it's up to you to decide whether you like that or not. Yeah. But
and I think
mean,
this goes,
an example on this, which I really appreciated. I was in, as I said, I was referring to Beijing and that air pollution has gone down. And I was in Beijing because of the Asian Infrastructure Investment Bank. they just launched a new plan strategy report on what they call planetary health.
Yeah.
And that report is only about their infrastructure investments and how their infrastructure, non-health sector investments are going to have an impact on people's health. And the president of the bank, the president of the whole development bank, this is quite a big entity today, said that health is not for us going to be a co-benefit. It's going to be our core benefit. And we're going to measure all our investments, infrastructure investment, in terms of health impact.
That's amazing. And they
that
found
was actually
they got
amazing.
Yeah. And they got buy-in. Like they did get buy-in from different.
Yeah.
That's amazing.
Then it's a matter. Then you come back to how do you do this? What kind of analysis do you do? How do you maximizing then both the economic impact, the health impact, the climate impact? What kind of analytical tools do you use to do that in the best possible way? What is the matrix you're using? I mean, there's a number of issues that needs to be, but they're very committed to work on that now.
So then I guess maybe another critique, and this is more about global health, I think, and how could health diplomacy help us or not. We talk a lot about fragmentation. I think some of your work, you said that global health is often fragmented by disease, sector, or bureaucratic silos. If you didn't say this, do let me know. You've worked inside of WHO, SIDA, Global Fund, and those are all entities that should coordinate. If someone then says, well, talking about health diplomacy, this just adds another level of bureaucracy, what do you say to them?
I say that you're totally wrong, of course. No, I mean, my comment on that in terms of what we have in place today and what we have had in place now for the last 25 years, I mean, in some way, it goes back to the old MDG agenda. It's been very useful. Investment in the 3 diseases, in child mortality, maternal mortality, and we see some progress. And the global sort of work, action, resources has been useful. But I think we're coming to an end of that era. So I think rather than thinking about the present system and seeing how we can reform that, or I would say that that's beginning to come, hopefully, to an end. And we need a totally different way of working where we have, of course, national plans, national priorities, and national financing that is driving. And the whole business model where resources are not coming from Minister of Finance in Sudan or in Kenya, but coming from the Global Fund, I think should come to an end. And I think, I mean, unfortunately, the way that the US now, what they did, how they acted by cutting the funds, that was brutal. But it was also not a bad sort of wake-up call that Minister of Finance now needs to allocate resources themselves. And many people have also now made that call that we need to get out of dependency. So I think the answer to the fragmentation, the verticalization of programs, the funds, I mean, my sort of vision for the future is that rather that sort of global system, especially when it comes to transfer of resources, money or commodities, I mean, that should, over the next 10, 15 years, being phased out.
I think then the last critique or maybe area of thinking, especially this I think came out last year when we were at the fellowship, is thinking about different stakeholders. All of this, we're talking about how we should work with governments. And I think you mentioned earlier, it's not just the government, it's different stakeholders thinking about health diplomacy. And you talked about the Minister of Finance, but also like a US as a government, but also other entities in the US that have different interests. And then that shows up in their global policy. It's clear that we have an issue of different stakeholders, but also power and accountability.
Yeah.
How do we think about, how do we collaborate with foundations that in a country like Sudan or Kenya will have a lot of impact, and they might not be accountable to a lot of people other than their managing directors, but also at the same time, and I struggle with this a lot because we try to address it, thinking about the private sector as another stakeholder, it seems to me the reaction to both of those is either full embrace or full retraction of saying, I don't want to work with either. I'm not sure it's either one of those approaches is actually helpful for health diplomacy.
I mean, in this year's program, we had a full day about the private sector because of some of what you asked and raised last year. But I think they are very different entities, sort of. I mean, private foundations, philanthropy, and private corporate sector, they're very different. So if I start with the private foundations in philanthropy, I think they will continue to be there. I think they will continuously be important. I see quite a few Asian foundations that are now emerging and taking more space. Also, I think what we will see is from the Middle East. I mean, the American foundations are the oldest one, not just the Gates Foundation, but the Rockefellers, etc. And I think they have been very important in terms of investing in research and innovation. What I think will be important for people who are partnering with them and are receiving resources from them is to regarding them not as a source of financing for recurrent costs. But one should be a bit careful using this kind of resources then basically for investment in development, research, innovation, catalytic projects, etc. But to see those resources as gap filling for recurrent costs in government's budgets, I think it's wrong. And I don't think they see themselves like that. On accountability, of course, they are private foundations and they have their boards, and you can't put them equal to government, a public government, and having a government elected being accountable. I mean, the ones that are accountable here for the use of those resources are the governments who are using the resources. So the government of Sudan, if they enter an agreement with MasterCard Foundation or the Gates Foundation, they are the ones that should be held accountable for doing that and how that money has been used. Mm-hmm. So I think this word accountability is also it's a mixed bag. Yeah. I mean, if you have a democratic system, of course, you have a government that should be held accountable for back to the voters, but you can't think about that in the same way as you think about a civil society organization or a corporate business. On the private sector, I think that's interesting because I think there is a very mixed bag here of big private multilateral companies that are really harmful for people's health across the world, producing things that are really not good for people's health, especially bad food, junk food. But I think the private sector is unavoidable. We need the private sector to produce drugs, vaccines, food, infrastructure, energy, etc. So the question is how we can work with the private sector, both to regulate them, but also to incentivize them to produce things that are good for people's health. And I think there are tendency today where people are beginning to see that private sector, corporate sector is not just the bad guys that are only basically getting the money and we're getting nothing out of that and they're just harmful. I don't think we can have that attitude to the private sector. I think we need to be open eyes, not naive, but we need to find a way also of engaging and understanding in terms of what is creating a private corporate sector that is actually producing things that are good for people's health, accessible for people when it comes to price and accessibility. So, I mean, my take on the private sector is that I think for us, from the public sector, we need to have even closer understanding, dialogue, but still being clear about, in some way, the Chinese wall here in between private and public when it comes to business, but still having more of an understanding in terms of how can we navigate towards what we want. Having access to a new drug at the right price, that requires dialogue in between, dialogue and negotiations between private and public. And then we need to understand each other a bit better than what we're doing today.
Yeah. So I know we're strict on time, so I just wanted to finish with a few questions looking at the future. The first one maybe requires a bit of reimagining. So as you said, you've been in the field for more than 20 years. And do you think multilateral institutions, I think you asked about, you said this earlier, do you think they're still fit for purpose in 2025? And if you could redesign the system altogether, what would it look like? Would there be some institutions or organizations that exist today that should be retired, or new institutions that need to be developed, given that we think maybe about climate change as a big challenge coming forward?
Oh my God, that was a big question. I mean, to simplify it a bit, we need WHO, but we need a WHO that is focusing on the technical normative work, but normative work not just being in Geneva. Normative work is happening in countries, and we need a strong WHO with high technical skilled people across the world in country offices. So WHO to refocus on high technical work, plus also some global convening role. So they need, in some way, I think, to move away from where they have gone now, which is much more into the operational supply business, which I don't think WHO should be doing. So a more focused, lean WHO, focusing on the technical work. UNAIDS is interesting. I think we should come to an end of UNAIDS, but UNAIDS is interesting when you say climate change, because UNAIDS was established to be able to take a multi-sectoral approach to a health challenge, to bringing 11 different entities in the international system together to deal with an issue that was not regarded to be a health sector issue only. That was why UNAIDS was created in 1996. So in some way, that approach still is needed to convene, to bring the international system together, different functions dealing with food, energy, etc. Ideally, WHO should lead that work. WHO was not trusted to do it in 1996. WHO is definitely not trusted to do it 2025, possibly in 2030. That's my hope. I think that is where we should go. Then in terms of a lot of the funds, I think, again, as I said before, we need to simplify that architecture. It's much too complicated. And I think we need to have a plan for basically phasing out during the next 10, 15 years in terms of that international support in terms of financial resources or commodities, drugs, bed nets, etc. So a global fund, Gavi, GFF, etc., bringing together and to think about what are the functions and have a plan for how you're basically going to not to, you can use the word sunset or phasing it out, but in a responsible way over the next 10, 15, 20 years.
Yeah. So
big reforms are needed.
Big reforms are needed. And maybe in a way thinking also at a times like this, exactly what you said, a lot of turmoil is happening, but maybe this is the time to actually reimagine things. Like this is forces us to think about a different way of doing things. I'll end with my last question. You're still hopeful. I can feel like you're still frustrated. If you're a young global health leader, global health technical officer, or anyone who's listened to this who wants to be more effective in health diplomacy in this current turmoil, what concrete advice would you give them? What should they do next? How can they contribute?
Call Salma.
What else?
No, I think there are plenty of opportunities to do things. You can do it locally in your own community. I mean, everything from making your own community more healthy, gaining your own experience in terms of how can you ensure that young people have access to more healthy food, more physical activity, better mental health. I mean, there's a lot that you can do in your own community. And then you can think in terms of how you can bring that experience also to changing policies. Yeah. And that could be changing policies with your mayor in your city, or it can go to the national level. So advice, start locally, gain some local own experience in terms of what this could mean in practice. Engage also. I mean, I would love to see more younger people becoming politicians. I've never been a politician. I think we need more smart young people being passionate about this, also going into politics. Yeah. If I would sort of both go into more on the academic side, my advice has always been that make sure that you have a little bit of a combination of your academic background. You can do medicine, you can do nursing, you can do public health, but combine that with political science. That is what I did. Combine that with a bit of management, project management training, or communication, or behavior science. I mean, to build your competence by both your academic sort of background, but also through your practical, gaining some practical skills and experiences.
Thank you, Anders. I think we'll have to leave it here for now. Yes. I have a lot more to discuss. I want to really talk more in the future, maybe about regional level interventions. I see regions becoming more of a really effective tool to enacting change. Also, maybe talking more about the future of multilateralism and climate change co-benefits. Hopefully, we'll bring you back for a different conversation. But thank you so much, Anders, for being here.
Thank you. A pleasure. Thank you so much, Salma.
This podcast was edited by Zach Leonaris and Catalina Melendez-Contreras. It is supported by the School of Public Health and Frick Initiative at Washington University in St. Louis. You can access this and other episodes wherever you get your podcast, or you can watch it on video on YouTube. Thank you for watching.